Normally, we don't feel our heartbeat. If you do, it's called a palpitation. People describe it differently, like a racing, pounding, skipping, fluttering, or hard heartbeat. Palpitation is an important sign. About 40% of people with palpitations have a heart rhythm disease called arrhythmia. The other majority of cases are harmless. Around 30% are caused by stress or panic attacks. Stress hormones like adrenaline are released. They make the heart beat faster and harder, leading to palpitations. Almost 20% of palpitations are caused by caffeine intake due to energy drinks, coffee, and alcohol. Because they are stimulants, they increase sympathetic nervous system activity, speeding up the heart rate or causing irregular beat. Alcohol, especially in large amounts, can trigger holiday heart syndrome. Other common causes are exercise, fever, dehydration, and medications, such as asthma treatment, bronchodilators, or thyroid medications. Also, recreational drugs like cocaine and amphetamines. Around 10% of palpitations are caused by electrolyte deficiency, such as low potassium or magnesium. Although most palpitations are harmless, I will tell you 5 signs which are red flags that palpitation requires urgent further investigation. First, when palpitation is accompanied by chest pain, especially pressure sensation on the heart, especially after 40, it can be a sign of a heart attack. Second, when palpitation is accompanied by syncope, fainting, or near fainting. It always requires further study because it suggests a significant drop in the heart's ability to pump blood, possibly due to life-threatening arrhythmias like ventricular tachycardia or heart block. Third, when tachycardia is prolonged and more than 150 beats per minute. 4. When palpitation is continuous, lasting hours to days, it suggests sustained arrhythmias like atrial fibrillation, which increase the risk of complications like stroke. And 5th, when a person already has heart disease, patients with prior myocardial infarction cardiomyopathy or valve disease are at higher risk for malignant arrhythmias like ventricular fibrillation. And when palpitation occurs suddenly and without clear provocation, it can signal a primary arrhythmia, such as paroxysmal supraventricular tachycardia or ventricular tachycardia. When it comes to pathology, 70–80% of palpitations are caused by premature heart contractions, more common from the atria and less common from the ventricles. Premature atrial contraction is when the heart's atria contract earlier than normal, and after this there is a pause before the next normal beat. This causes a sensation of a skipped beat or fluttering. Usually it happens when heart excitability is increased, for example due to stress, stimulants, or atrial irritation. Alcohol, caffeine, smoking, hypertension, and obesity are the major risk factors. This arrhythmia is almost harmless, but if frequent, it can increase the risk of atrial fibrillation, which is a more serious arrhythmia. A premature ventricular contraction is similar to atrial contractions, meaning there is a contraction that is premature but originates in the ventricle region instead of the atria. Patients feel palpitations more pronounced. People describe it as a thumping or pounding sensation due to the compensatory pause after the premature beat. Premature ventricular contractions can also be caused by stress, caffeine, and stimulants, but are also caused by structural heart disease, coronary artery disease, and cardiomyopathy, although itself considered safe. If premature ventricular contractions are frequent, it can increase the risk of cardiomyopathy or worsen heart failure. For treatment, lifestyle changes are recommended. Reduce caffeine, alcohol, and stress. For treatment, beta blockers or antiarrhythmics are used for symptomatic or frequent premature contractions. The third most common cause of palpitation is atrial fibrillation. Atrial fibrillation is serious and considered the most common arrhythmia at the same time. Patients describe this palpitating. My heart feels like it's fluttering or quivering. Also, my heart races suddenly for no reason. The risk of atrial fibrillation increases dramatically with age, 1% of the general population and 10% of individuals over 80. Atrial fibrillation is an irregular, often rapid heart rhythm that originates in the upper chambers of the heart, the atria. It occurs due to chaotic electrical signals in the atria, leading to uncoordinated contractions and impaired blood flow to the ventricles. Disorganized atrial conduction is common. The atria quiver instead of contracting effectively, causing incomplete blood emptying. The ventricles receive erratic electrical impulses, resulting in an irregular and often rapid heartbeat. And blood pooling in the atria increases the risk of clot formation, particularly in the left atrial appendage. Triggers and risk factors of atrial fibrillation can be acute stress, alcohol, infection, surgery, hypertension, coronary heart disease, valvular heart disease, and obstructive sleep apnea. Also, hyperthyroidism. Important risk factors are obesity, smoking, excessive alcohol or caffeine consumption. Atrial fibrillation is important because it increases the risk of stroke 5 times. Due to blood clots that form in the atria, also atrial fibrillation increases the risk of heart failure. Another cause of palpitation is supraventricular tachycardia. This arrhythmia is common in young people and females with sudden onset of palpitations and sudden termination. Heart rate ranges from 150 to 250 beats per minute and can last from seconds to hours. Frequent episodes can cause significant discomfort, anxiety, or panic. Prolonged or recurrent SVT episodes can lead to tachycardia-induced cardiomyopathy, weakened heart function from persistent rapid heart rate, and heart failure, but rare. Vagal maneuvers are the treatment in this case. Other common causes of palpitations are sinus tachycardia, which usually occurs in response to stress and exercise, and also due to illness. Ventricular tachycardia, which is life-threatening and usually happens in people with structural heart disease. So in people who already have known heart disease, it can increase the risk of cardiac sudden death,